connection you can count on. From just about anywhere. That's extended easy work. Cut your mobile bill in half. Plus, try it free for a year. Xfinity. Imagine that.
Yeah, can you hear me? All right. Good afternoon, or rather, good evening. I guess most of us are calling in from Nigeria. I'm really sorry for starting a little bit late. I was running very late at work. Most times, I was supposed to finish by 12, but some things happened, and yeah, some things happened, and I had to add some delay. All right. Okay. Let's start. I know this is the second time we are meeting to talk about the USMLE step one stuff, and uh, as members of CMDA, just like I told you earlier, the reason why we decided to organize this is so that we can help as many of us that have that dream of pursuing a residency here in the US. I understand one of the things we discovered is that a lot of us are not able to pursue our dream because of the fact that we don't really have people to guide us. A lot of persons feel that the journey is very difficult or is impossible or is something that is not doable. But with proper guidance, I strongly believe that it's something that anybody uh, can be able to do, and that's actually the essence of this mentorship. And outside outside sorry outside these our online meeting, we also plan to after now divide us into discussion classes and just have our little group so that on our own we can start preparing depending on based on whatever level we are in our preparation so far. All right. So this meeting is there are two different angles to it. First of all, we'll be talking about how to go about the registration process. Then secondly, we will be talking about how to prepare for the exam proper. All right. A lot of things have changed from the time I got my step one till now. All right. And during our own time, we were using OASIS, that's ASIS, but it was transitioned to my Int Health. That was sometime last year. And with that came some changes that we didn't have to go through during our time. All right. So, first of all, when it comes to the current my health registration, there are some things that are actually involved. Initially, before to get your ECFMG number, that's your unique ECFMG number, you don't have to pay anything. You just go to www.ecfmg.org and you fill in your details, after which you generate your ECFMG number. But uh, with my int health, some things actually changed, and which the one of them is that to get ECFMG number, you have to make certain payments, all right? And the website changed from ECFMG to www.myinthealth.org. Okay, so when you go to that website, I would probably give us a little summary. in the WhatsApp group after our this current meeting. Go to www.myintel.org. Then you have to create in your login details, your your with your email, and also create a unique password. And after you open my Intel, under my Intel, there are two different options. You have to go to the applicant account because you are applying as an applicant. You go to applicant account, and when you go there, you click applicants and fill the forms that are required of you. After filling the form, that's where you now make the first payments. All right. And from what I learned, the current payment is $110. And after making that payment, you have to wait for like one to two working days or thereabout, depending on how busy they are. They will now send you your unique EFMG number. All right. And that is actually the number that you use to register all your exams. The number stays with you throughout. When they send you that number, you are now eligible to do what we call identity verification. Okay. And for that identity verification, usually you will need your international passport and the other informations that they require from you. And the identity verification is as simple as they just want to verify your identity. Let me also say that before you can be able to do identity verification, you must have a valid international passport. So if you don't have a valid international passport, I mean international passport that is still current, not the one that has expired. If you don't have any, I think you may need to get an international passport. All right. Then when you now do the identity verification, just want to verify that you uh, that you are whatever information you provided is correct. And usually, how they do it is that after you have to choose a particular date where you kind of have a Zoom call with the person that will verify your identity. All right. And there are different dates that you see on their website. Sometimes they will say the email of the date that are available. You choose the dates, and on that day, most times it takes less than 10 minutes. It's not something that takes a lot of time. You just come on a Zoom call. They just want you to, they will ask you some questions, verify your name, verify your date of birth, verify one or two other informations, and also verify some of the things you wrote in your international passport. Then you want to make sure that your first name, your middle name, your last name, how it is written, which one comes before which one is accurate. They want to make sure that your date of birth is accurate so that to avoid errors and mistakes along the line. Okay. So, and after that point, you will now, when you succeed, they will now uh, forward you or be forwarded to ECFMG, more or less like tell them that it's been confirmed. And usually it takes a couple of days, sometimes it may take up to a week. And after they've confirmed it, you can now, they will now give you my Intel's number that you use to make your payments. All right. And at this point, there are actually two different payments that you actually make. Just give me a minute. Let me confirm. Apart from the $110 that you pay initially, there are other payments that you have to make before you are eligible to pay for your step one. All right, just give me a minute. Uh, I know that there are yes. So to get that, to create my Intel account, you pay $110. All right. Then for you to do the application for ECFNG certification now, you pay $560. And there's what we call credential verification. You have to verify your credential. And how it is done is that most times we tell them that you are a medical doctor, finish from this school, this and that. You have to verify those credentials, and you have to pay $200. Is after you are able to finish these three steps that you can now be able to write your step one or rather apply for your step one. Okay. I know that this may look like a huge amount of money, but the truth is that the difference between what we paid during our own time and this current payments is less than $100. And the reason is because in our time, the payment for step one was $1,020. But currently, the payment for step one is $695. So, with the whole changes. What made it look as if it's expensive now is because you have to make some payments upfront, like much payment upfront before you can now pay for step one. So you pay $110, you pay $560. I think they added like $20 to it, maybe $580 now. Then you pay 200 or $220, which will come up to about 800 and something dollars. All right. And after which you can now be able to apply for your step one. I don't need to understand my explanation. But in our own time, we just have to pay $160 after you get a CFMG number to do the verification. Just pay $160, and after which you can now pay for your step one. But the difference there is that our step one was 1,000 plus. Now step one is $600 plus. And the same thing with step two. The price of step two and the price of step one are almost the same thing. So at the end of the day, by the time you add everything you have to pay, discover that the difference between what it was about 1 year ago or 2 years ago and what it is now, just barely $100. So it's really the difference is not so much. Okay. So after which you can now apply for your step one. And when you are applying for your step one, I used to tell people one of the problems that people make is that they start reading, start preparing for step one without going through the process or without starting the process of this whole verification, getting say, my int health number and the rest. And where that is a problem is not like it's a problem. By the time you are ready to apply for your step one, this whole process may take you up to a month, sometimes 2 months. Let's say, for instance, you want to write your step one in July. If you start this process in June, you may not be able to complete it by July. And the implication is that if you complete it by July and apply for step one in July, they will push your dates to August. So, and when you're applying for step one, there's what we call eligibility period. Eligibility period is like a 3 months gap that you are telling them that I want to write this exam within these 3 months. Let's say you want to write the exam in September. You can decide that your eligibility period will be August, September, October. Or you can do September, October, November. Or you can do July, August, September. You are the one to choose the 3 months that is your eligibility period. What it means is that I must write this exam within these 3 months. Okay. But if peradventure something happens and you are not able to write the exam, if something happens and you are not able to write the exam within that period that you stipulated, you can be able to shift the exam within that same period. For instance, you want to write in September and probably family emergency came up and you discover that you are not ready to write it in September, you can push it by 1 month if it is within your 3 months eligibility period. Can we all still hear me? Can we still hear me? I just want to be sure that we are still here. All right, thank you. Okay, so and that is how it works. You must write that exam within that 3 months eligibility period. And the caveat there is that if uh, you want to shift your exam and it is less than or it is more than, I think it's 40 working days, you can shift your eligibility period or you can shift the date without making any payments. But if it is less than that stipulated time, if you go to their website, you will see their timing. If it is less than that stipulated time, there's an amount of money that's more like a penalty or a fee that you pay, depending on how close your exam date is. Let's say, for instance, you are supposed to write your exam on the 12th of July, and on the 10th, I mean, something happens, you missed your flight, and you discover that, oh, you can't be able to get to the venue on that particular day, or maybe you fall sick, something came up, you can actually shift. But the only criteria to shift is that you have to pay a certain amount of money. I think it's about $100 or 80. I can't remember how much it is now, but it is in their websites. But if you want to shift in when it is still more than, I think either 30 or 40 working days, I'm not too sure, you can shift it once without payments. But your shift must be within that eligibility period. And that is why that eligibility period is very important. And I tell people that if you want to write in September, it's actually best to make your eligibility period September, October, November, so that you have enough time to shift rather than putting it July, August, September. All right. And so that because at that way, you will not have much room to shift, or even when you want to shift, it may require you to pay. So that is the thing about eligibility period. And why I have to bring it up is that before you are able to, when you're already preparing, you should try as much as possible to take it together with your preparation. I mean, your registration. Make sure you are doing your registration or starting the process together with your preparation so that you will not be ready to write the exam and you will now start the process of registration and it will still take about 2 months to complete the process. All right. And I used to tell people that the only thing that uh, gives that guarantee, or rather, that gives you that level of commitment that you are ready to prepare or pursue USMLE is when you commit financially. I don't take anybody serious who have not started the process. I mean, you've not made starting payments. It's what shows that, yes, I'm determined to pursue this process and go about this USMLE. So, if even if it is paying the $110, start the process of the registration together with your study. Okay, I think that's it about the registration process. You must first of all understand what is the period you want to write the exam, and for you to be able to understand that. I know somebody asked a question about how many months it takes for one to prepare for step one, and my answer to that question is that it varies. It's not fixed. One, it depends on how free or how much ready you are to commit into doing active studying, intensive studying. Number two, it depends on how much medical knowledge that you still have. I mean, if it's been a long time that you left medical school, you have a lot of things to still brush up. Or maybe you are even still in practice, and let's say you are doing residency in a particular specialty. Let's say you are in O&G doing residency, and you want to start the process. The truth is that you might have forgotten a lot of things in pediatrics, internal medicine, surgery. So you would need to still have to start brushing up those areas. So it may take you much more time compared to somebody that just finished from medical school that is still fresh, those knowledge are still there. So it depends on your unique individual experience, okay? But the most common general consensus is that your intensive active studying within 4 months of intensive studying. What I mean intensive studying is that you are giving it all your attention, you are studying, like this is what you are doing. Within 4 months, you should be able to prepare and write the exam and pass the exam. All right. However, I know that most times how it really happens is for some of us, in the when we are starting, most times we may not really be so serious about it. We are taking it gradually, we are studying, and most people get serious with the exam after they make their payments. If you have paid that, yes, I'm going to write this exam by November, you already had a date to write the exam. So that's when most people start studying very hard because they already fixed a date for the exam. So that's why I said the timing of the exam depends on some of these factors. If you are still working and your work schedule is very busy, it depends on how many hours you can be able to cop out every day to study. Okay. All right. Then the second thing I also ask people is that it also depends on when you want to match. I mean, matching means starting residence. Which year you want to start residence? You must have to factor it in so that you can balance your time together. If somebody is telling me that I want to start residency next year and I'm starting the process now, the truth is that it's actually impossible. I don't want to say it's difficult. Why I say it's impossible is because one, you've not registered for step one, you've not registered for step two, you've not actually gotten your ECFMD certificate, and there's what we call errors. Errors opened on the 1st of June, meaning that people that want to apply next year have already started getting the applications and many other things ready. So you have to plan and decide when do I want to match so that you can be able to plan yourself and plan your days and plan your schedule and be able to focus and make sure that everything is in line with your stipulated time. So it is very, very important. Let me just use, for instance, somebody that wants to match in this 2026, somebody that wants to match in 2028. 2028 means that you'll be starting residency on the 1st of July 2028. So let me start taking it backwards from there. All right. And what it also means is that by March of 2028, you should match. We'll call it matching. And it happens in March, usually the second week, or rather the third Monday of, either the second or third week of March. That's the March week. Okay. So it means that you must have matched, you will match on that March of 2028. And what it means is that by September of 2027, you should have submitted your applications, because you submit application in September, then from October till January, that's the interview season. So programs will start sending you interview invite and you start interviewing those programs. By February, you do what is called ranking. I won't bore us with the details. So by September, you're already done with your applications. So what it means is that by August, you must have written your step one and step two. That's August of 2027. So the implication is that from now, which is June of 2026 till August of 2027, you must have written your step one, step two, OET, and gotten your ECP certificate. So it is possible to apply next year September to be able to match in March of 2028. However, what it implies is that you must have written your 3 exams, step one, step two OET from now till August, so that you can be able to get many other things ready. There are many other things that you also need, which I won't also bore us, all right, because you are just starting the whole process. Yeah, in people that are in other groups, step two, step three, and even others, we have different things we discuss with them depending on based on the stage they are in the process. If you have questions, you can also be writing it down in the chat so that once I'm done, I can be answering our questions. All right. So that's it for the registration. Then coming to what do I study? What do I read? All right. The truth is that step one is it's more vast compared to step two. And the materials in step one are a little bit much than when you compare it to step two. Step two is like the building block of step one. So if you studied step one very well and did step one very well, step two will also will be easier. That's why most people spend more time preparing for step one compared to the time they spend in preparing for step two. Because once you have a good foundation in your step one, you should be able to just give some notes and write your step two and do very well. And let me also say at this point that step one is pass or fail. Before, it used to have a score, but sometime in January of 2021, if I'm not mistaken, they changed it to pass or fail. And what it implies is that there is no score. However, uh, people still fail step one. In short, it was discovered that the failure rate of step one increased when they switched to pass or fail. And I understand why that is so. It's more like a psychology. When it still have a score, everybody is still trying to prepare for step one to have a particular score that is competitive enough. So we are not preparing to just pass, just like somebody that is writing JAMB, for instance, for those of us in Nigeria. To prepare for JAMB and you want to study medicine, you know that it will be very competitive. So you want to get a very high score that is competitive enough to give you admission into the university you want to go into. However, we all know that the cutoff mark in most schools are usually the general cutoff mark may be 180 or 200. That's pass of. So that's actually how what actually happens. The pass mark for step one is a bit lower than what people we are aiming for when it used to have a score. But because now it's no longer scored, most persons can decide to go and write the exam when they are not ready to write the exam, when they are not prepared enough to write the exam. Okay, so uh, that's the thing. But the point there is that yes, passing step one is actually the pass percentage of people that pass step one, I think it's up to 90%. So it's not like it's something that people feel or that sometimes it's not doable. All right. Okay. Let me answer this question. If I go to how do you prepare for step one? Somebody is asking, registering for must I be a doctor before I register? No, you don't need to be a doctor to register for step one. You can actually be in medical school. I know some persons that do their step one, step two while in medical school. So you mustn't be a doctor. Actually, some you can even match into residency just when you are without having your permanent license and just finishing for medical school, you are starting your residency immediately. There is a way around it. Okay, but I want to also boss with that. So if you're in medical school and you're applying to write step one and you have the money and you have whatever it takes, go ahead and start preparing and write your step one. It even makes it easier because USMAD or rather programs favor those that have shorter year of graduation. But that doesn't mean that when your year of graduation is has been, that doesn't mean that when you've graduated a long time ago, they cannot apply for step one. I mean, some of us, I was more than 10 years postgraduate like, when I applied and I still matched. So that's not an issue. Which when we come to that point, we'll discuss how to navigate it. So the point there is that if you're in medical school, you can apply. Even if you are 20 years postgrad, you can still go ahead and do it if you still have the energy to study and go about the process. Somebody asked, is IMD app recommended for USMA preparation? I don't know what's IMD app. That's the truth. can explain what it is, but I've not heard about it before. I will talk about the whole process of preparation so that we know what is required from us. Okay. Somebody asked about the cumulative sum. If you are in that group, I will send a file of the amount that is involved. If you are in USMLE step one group, I will send after this our discussion. I'll follow up with some files, some things that we need to prepare for step one. All right. So, but uh, and I will send us the the breakdown of the amounts that is involved. Okay. Then coming to what you need to read or study for step one. Well, there are a lot of materials out there when it comes to step one. But I used to tell people that as much as possible, limit the materials that you are studying to the most necessary or the most important. The reason is because it's just like those days in medical school, there are a lot of textbooks that are out there. You know, in anatomy, you have LAS, you have Ketmore, you have Essential, you have this, you have that. But you don't need to read everything to be able to pass your anatomy. Just focus on the important ones, on the ones that will give you most of what you need to know for your step one. And the most important textbook for step one is your first aid. We actually call it the Bible of step one. It's like it's the most important textbook. So you are preparing for step one, you must be able to study your first aid. First aid is a textbook. Study your first aid and know it very well. Okay. And that is the most important textbook. I will still break down some of these things for us in the group. I just want to explain some of these things. And first aid is divided both into system wise and subject wise. I mean, but people usually advise that if you are studying first aid, if you are reading for step one, you can do your first pass of first aid. What I mean is read the first aid from cover to cover first before starting other studying material. Because first aid is a little bit, is a bit condensed, but you need to first of all read it and have a holistic view of what's required from you. And people have their different formula, different way of going about it, but usually advise make sure you go the first pass of first aid. It may take you a couple of weeks or a month, or depending. All right, and don't be intimidated by the number. Uh, these are some of the things that we already know. For those of us who are, I mean, once if you've been able to finish up to your 500 level, or you've done your anatomy, physiology, biochemistry, pathology, pharmacology, the whole pharmacology, microbiology, histopath, and the rest. Then you've done your part of your O&G, pediatrics. I mean, you can be able to, you are familiar with whatever is required from you for step one. Actually, here, students write their step one when they are in M3. M3 is uh, we call it the level where we call it in my 400 level, depending on your school. That's after after pathology and pharmacology class. That's when they write their step one. Then they write their step two when they are in fourth year. Fourth year is when they are now doing those clinical, internal medicine, O&G, medicine, surgery. All right. Is there something we need to buy from a site? I'll still talk about it. Okay. So first aid is the most important textbook. Then there is a question bank that's also very, very important at first aid. We call it U-Word. U-Word is like a question bank. It has about 2,000 questions and is divided into subjects, system, which if you're preparing for step one, you must have your U-Word. It's very, very important. It's something that you cannot do without. Sorry, a minute. So you must have your first aid. Sorry, U-Word. And I know U-Word can be a little bit expensive, but there is a way around it. I tell people, one, if you cannot be able to afford the 6 months subscription. You know what comes in subscription. You can do 1 month, you can do 3 months, you can do 6 months, you can do 1 year. If you go to their website, you see the price for all of them. And I understand that most of us that are in Nigeria with the whole exchange rate and the whole thing, it can be a bit expensive. Imagine doing a 6 month subscription that will cost you about 300 and 400 something dollars. If you go to their website, you see the current price. So, but what you can do is 2 or 3 persons can come together and contribute and pay for a subscription, maybe 6 month subscription. 2 persons or 3 persons come together. One person will be the one to make the payment. Everybody has the login. And when you are answering the questions, as you are choosing the question block, you just write your name there because you choose questions for by set of 40 questions. So as you are choosing whatever set of 40 questions, just write your name there. What it means is that once you are done, and so once you are done with all the questions, you can go to whatever the other questions that the other person answered, so that you can also see the other questions there. That's if you cannot be able to afford paying for the whole question, but 2 or 3 persons come together and pay for first aid. Sorry, you word. And although somebody was telling me about some subsidized U word, I really don't understand how that one goes. Which, if I get the information, I will send us in the group. So that's you. But what I'm trying to say that U word is very important. It's as important as first aid. Actually, these two are the most important materials that you need. All right. In addition to U word, or rather, in addition to first aid, there is a textbook we call Patoma. Patoma is like a histopathology textbook. However, you don't need to read all of them. You just need the first 5 chapters of Patoma. And it's very straightforward. It's very, I mean, it's very short. Within a short period of time, you should be able to cover it. But it's actually very, very high yield. It's very, very high. You need that Patoma. I will also look for it and send it to us. Okay. So that's it for U word, first aid, Patoma. There are other materials that people do. Okay, apart from this, another one that is very important is your NBME. Uh, MBME. MBME, actually, people use it a as more like a way to assessment tool to assess how prepared they are for the exam. And MBME, the questions are it mimics closely the way the exam is structured. So, which if you go to MBME websites, usually they have subscription to MBME. However, some persons have some people have a way of getting it. So the point there is that you also need your MBME, but MBME is be like an assessment tool. Use it to know how much prepared you are for the exam. And I tell people that you must be able to be passing your MBME very well before you go and write the exam. Let me give you an instance. When I wrote my step 2 and I was doing my MBME, the final score I had in my step 2 was the average of my last 3 MBMEs. So it actually mimics how much well you are going to perform in the exam. So let's say, for instance, the pass mark of step 1 is 196. If you are doing your MBME and you are having 150, 160, the truth of the matter is that you're not ready for the exam. When you start having consistently 220, 230, it means that yes, if you write this exam, bearing whatever unforeseen circumstances that happens during the exam, tension and all those things, you can still be able to fall within that 196. Hypothetically, that is a pass mark. All right. So that's why that MPM is very, very important. And so these three, your first aid, which I'll add Patoma to it. These are textbooks. You have your U word. U word, use it for preparation. As you're answering the questions, they are explaining those things to you. The MBME is for an assessment. And I usually tell people that it's usually best before you start for you to do your baseline MBME. Baseline means you want to know my the level I am now when I'm starting this exam. That way, if you are not doing me once every month, you can see your rate of progress, how you are progressing, and it will give you an idea of when you are ready for the exam. Don't go and write the exam when you are not passing your MBME very well, because the truth is that if you fail step one or step two, that doesn't mean that you will not match. I know some persons that know their steps and they still match, but it's already a red flag. It's a red signal. Okay, it means that it has reduced your chances of matching, and and it's now worse if you have other red signals, red flags like you are an old grad, even being an international medical graduate, meaning that you are finished your medical school in Nigeria or any country outside the US, international medical graduate. It's even a red flag because they favor their US citizen, which is actually normal. All right. Even not even being a visa requiring even requiring a visa is but I mean these are things that uh, I mean people always, it's not like it's something that is very, very serious. But the point there is, as much as possible, make sure you are ready for your step one before you write your step one. Don't, out of overconfidence that yes, I can be able to, just make sure you are passing your MBME very well and you are doing very well before you write your step one. I'll still give us the whole details of some of how to assess some of these materials. Then the miscellaneous, I call these other ones miscellaneous materials that you need depending on whatever study strategy you want to employ. One is a video called Board and Beyond. All right. Board and Beyond is a video that kind of explains some of the things that you need to know for your USMLE. And excuse and it's like a video which is very, very high yield. It kind of explains a lot of things. I mean, if you are somebody that learn very well uh, through video, you can do Board and Beyond. You'll be watching your Board and Beyond videos, and it's very, very high yield. Like it's very, very high yield. In addition to that, there's what we call sketchy pharmacology and sketchy microbiology. It's like a cartoon, using animations and cartoons to explain different concepts of microbiology and pharmacology. It's also very high yield, meaning that you can understand a lot of subject matters, topics with those things. But that's if you're also somebody that learn with videos, cartoon. Then another miscellaneous, very high yield material that you can use is a podcast called Divine Intervention Podcast. Don't worry, I will still give us the breakdown in our group. Divine Intervention Podcast. Divine is actually a Nigerian, but he did his medical school in, I think it's Harvard. I can't remember. I mean, and just Google www.divineinterventionpodcast.com. You see all his podcasts. There are about 400 and something podcasts now. And these are very high yield materials that you need for your exam. So, but you don't need all of them. In in those podcasts, you have step one materials, step two materials, step three materials, even in training exam materials. So just go there, go to the folder where they wrote step one, and download those podcasts there, and start listening to them. All right. I mean, it is very, very high yield. Some of us didn't know about the podcast until when we started preparing for step two. And it really helped us a lot. So the interaction podcast is something that you can do. But I call it miscellaneous, meaning that mean, I didn't use it in my step one and I still passed, but having access to it can help. And having a podcast that you can play anywhere, you are driving or coming back home, you're at home, your free time, you're playing the podcast is really, really helpful. It's also adding knowledge. Even now, as a resident doctor, I still have the podcast and I still play it. I just selected one related to my specialty, and I'm always playing the podcast. It's also part of learning. So if I actually did justice to a whole lot of topics as pertains to USMLE. So you go to the website and check out the Divine Intervention podcast. Right. I think that's it for the materials that need to study for step one. Your first aid, your patoma, your U word, MBME, and the miscellaneous videos, Divine podcast. There are many other materials out there. You can see Kaplan videos. The video maybe is more than beyond. Kaplan has a video, and there are many other materials that you see out there. But I tell people that you don't need to read everything. You don't also need to have your hands on many materials so that when you want to revise, when you want to go through what you've studied, it's easier because it's something that you've studied very, very well. But if there are three that you must have your first aid, you must have your U word, and you should be able to be doing your MBMEs. The other ones, I call them miscellaneous. Okay. And how do you approach it? I've said it earlier. First of all, my method is start with first aid, go through it first pass. All right. For me, I love hard copy text. I'm not a fan of soft copy. So I had to buy the hard copy. Go to Amazon, order for it. It comes to you. But if not, there are soft copies out there that have access to the soft copy and be studying the soft copy if you are somebody that can also study stuff. Use your first aid, go through it, then get your U word and start answering questions. And every now and then, between your MBME assessments, can be doing your MBME. Usually, I tell people that if you are 8 months away to writing your exam, you can be doing MBME once every month and be knowing how far you are progressing. But once you are, let's say, 3 months to writing your exam or 4 months, you should be doing your MBME once every 2 weeks. Then you are getting to 2 months writing your exam or 1 month to your exam, you should be doing it every week. And the good thing about MBMA is not just it doesn't just give you a question and assesses you. It also gives you the explanation. It's also you word. But the thing there is that it's more like it's the way it simulates the exam and how it looks like. But that you word is actually you must is actually what you need as far as step one is concerned. All right. Uh, uh, then after going through the first part of your word, you can now start your first part of your MBME of your first aid. You can now start your U word. And I tell people, I mean, there are different strategies. People have their different way of studying, but depending on which one works for you, you can decide to do it system based or do it general. System based means that maybe you go to your first aid, you study anatomy, you go to your ward and do all the anatomy topics. Or you can decide to just select randomly, allow the system to select it randomly for you and give you 40 questions every time. It is general, it's random stuff. Meaning that out of those 40, you may see a question in anatomy, see some G, see pediatrics, see physiology, just see random questions. Which usually I tell people that when you are months away to your exam, you need system based because you want to understand different systems. But when you are close to your exam, you should bring it in general because uh, In the exam, they will not tell you that this topic is anatomy or this topic is pathology. It comes randomly. Your first question may be pathology. The second one may be pharmacology. The third one, microbiology. So it comes randomly. So doing it system based may not really help to be able to be, have yourself being spontaneous and answer the different questions depending on whichever topic that comes. But as you are starting, you can decide to be doing it very like system based. Okay, let me finish uh, anatomy. Let me do biochemistry. Let me do this. Let me do that. But close to the exam, you can be able to do it. You should be able to be doing it uh, general or randomly. All right, I think that's it for it. If you have other questions, you can put in the chat box. So after now, I know that a lot of persons have been in my DM asking a lot of questions. So what we are going to do is that we are going to send uh, a form for us to fill, and in that form, we want to divide us into different discussion groups so that we can start having discussion sessions within ourselves. The reason is because I tell people that one of the mistakes anyone would make is preparing for USMLE in isolation. Why I say so is that it's not a must if you're not a discussion person. It's not a must you must be in a discussion group. However, when you are preparing for the exam, it's actually very important to identify people that are preparing that exam with you. Why I'm saying so is this: it can be discouraging at some points. It can be overwhelming. What I mean overwhelming is that you now discover that there are many things that you need to study. And if you don't have other persons that you guys are going through the same thing at the same time, you can easily give up. Or even if you don't give up, it may elongate the timing of your exam. But if, say, for instance, you have someone that you guys have already decided that you are writing this step one by January or February of next year, even when you feel like, let me just pick these dates, you just know that, we already decided, there are people that are around you that are like a motivation, they are giving you that push that you need towards preparing for that exam. So, and that is also why we created this group, so that you can also see others preparing for that exam, so that you can ask your questions. Why is as if the group is not really very active? Is because we want to have this session with us and now implement the process, meaning that people are you can ask your questions, and if anybody have answers to it, the person can answer the question. More like a community of those preparing for the exam. And you can also have people that are your discussion groups that you guys have days of meeting to discuss things related to USMLE. All right. And then you also say here that one, the prerequisite of being in a discussion group is that you must at least be ready or have a time where you want to write the exam. If you are still a medical student, probably you are still in your fourth year and you are hoping to start the process when you graduate. You can just be an observer, but there is no need of being in a WhatsApp discussion group where people that want to write in 3 months or 4 months are there. And being there is it's really not be an encouragement to them. All right. Then the second prerequisite, not a prerequisite, we also have group leaders. I'm just trying to give us an idea of how it's going to have people that are going to help the group, because we will not be there. We just have people that are just leaders of different groups. And meaning that the leaders coordinates uh, uh, the leaders coordinate whatever happens in the group. But will talk about this in the step one group. And let me also say that if you are not in the step one group yet, I'm not talking about the general group. Everything I'm talking about will be happening in the step one group, all right? And I think that's how we're go about it. Now, before I conclude, if you have other questions, please just put it down in the chat box, and let me answer them before we call it a day. Somebody asked, is there a season for step one registration? Like from January to December? No, there is no season. Whenever you are ready to register, you go and register. It doesn't have a particular date or time. When you are ready, register for your exam and write your exam. They also say is that if you are in Nigeria and you want to write step one, there is no step one center in Nigeria. You have to go to Ghana to write the step one. I mean, Nigeria happened to us. I heard there used to be a center. Things happened and it was cancelled. So now we have to go to Ghana. And what it means is that you have to pay an extra $100 of I can't remember what they call it, but it's just more like you are moving to a different country, write your exams and all those things. And it now you have to factor in your flight tickets or your bus transport. Some people go through land if you cannot afford it. Go through land, write your exam, come back, and the rest. Okay. Somebody said the materials for yes, I'll send it. Somebody said, won't you what serve the same role as MPME? I would say no. For step one, yes, you word is actually one of the most important. All right. First aid, you word. But MBME kind of gives you an idea of how ready and prepared you are for the exam. So I advise people, make sure you are doing your MBMEs. I mean, you can be doing your U word and you're having 70%, 80%, and you feel that yes, I'm ready for the exam. But when you do your U word, it now kind of gives you an idea of how much ready you are, if you are likely to pass the exam or not. So, I mean, uh, as far as USMLE is concerned, U word is very important. MBA is very important, rather. Does first aid contains all the system from anatomy to pathology? Yes, it contains everything. That's why I call it it's like the Bible of USMLE, meaning that everything you need to, every topic you need to know is there. However, it is concise and it's condensed. Imagine the whole topics, or rather the most important things when it comes to anatomy, physiology, biochemistry, uh, uh, pathology, or rather histopathology, microbiology, pharmacology, all those things in one textbook. They're actually very concise. So that's why you need the first aid. Then you also need your U-word. U-word kind of gives you questions. And when you answer, it gives you explanation of those questions based on USMLE standard. I think I've answered all the questions that I have here. And we'll continue from the group. Thank you so much for obliging me. Thank you for joining in. I want to apologize for the whole changes, shifts, and a lot of, the time issues. I mean, I had some issues. I had some things at work, and I thought I would be able to make it earlier. But uh, this video will always be here for those of us that want to come back to it again and again. I think I have 3 videos now when it comes to step one. You can look at it from the channel and see the other videos I made and kind of listen to it and also get more information. I tell people that one of the things that is very important as far as USMLE is concerned is information. That's why I said it's something that you don't do in isolation. Information is very important. Without information, you think that you are doing very well without knowing that you are making a lot of mistakes. I want to tell us my personal story because I'm live. But the point there is that you just have to make sure, one, make sure you get as much information as possible. Number two, make sure you are in a community and don't study in isolation. That isolation, when you do it like personally, you want to now study. Most times, people just want to just do it on their own. At the end of the day, I'm not saying that you will not do well, oh, but it may make the process longer and more difficult. But when you are in, let's say for it, just like the meeting I'm going to have with those that are applying this year. Some of the information I'm planning to share with them are some of the things that I discovered later on after I've made my mistakes. So just imagine that somebody wants to apply this here and it's not in a community where some of these informations are provided. The person will still go there and make mistakes. And by the time a person goes and they match the first and second time, now start learning from his mistakes, which doesn't actually make sense. All right. Thank you so much. God bless us. And you have an awesome rest of your weekend. God bless you.